Hello, I'm Dr. Robert Lelouch, board-certified OB/GYN physician with over 30 years of clinical experience. And today I want to talk about what you should do if you decide not to follow what your doctor prescribed you or your doctor's recommendation. I'm going to try to keep it a little more specific, but let's say your physician prescribes you medicine and then you decide you don't want to take it, or you're not comfortable with the recommendation, or you were too embarrassed to say that you didn't want to take it, or you read the side effects on the label afterwards, or you Google it afterwards and you decide, nope, this isn't for me, I don't want to take it. So what should you do about that? Well, first of all, I want to tell you that as physicians, we're here to do our best to give you the best healthcare available, but we don't know everything. And not all answers are black and white. There's lots of gray zones. There's recommendations, and it's up to us to give you as much information as possible so that you can make a sound decision. And sometimes you might change your mind, or you disagree with your physician, and that's okay. What we as physicians encounter sometimes is that we believe that a patient has decided to go along with the treatment, and then later that patient decides to change their mind or to not do that treatment. And what I'm asking you to do is, if that's the case, and that can be okay, let your physician know, okay? Let them know, because sometimes the consequences of no treatment are more dangerous than the consequences of some of the things that you read about on your medicine label, or on with Dr. Google. We want the opportunity to have some input. As physicians, we understand that not all decisions, like I said, are black and white. There's some gray zones, and it takes time, and we encourage you to let us know, because, for example, if you're given an antibiotic and you find that there is a side effect from that antibiotic, or that it has an ingredient you're allergic to, well, if you still have an infection, that infection needs to be treated. Makes sense, you would call up. But perhaps you're feeling a little better, you decide you don't need the medicine. Well, there might be some infections that get worse or are in more danger later on. Or, for example, you have a medicine to treat osteoporosis. There's a whole video I have on osteoporosis. That's a medicine that you take that you can't really see it working, and so lots of patients agree to take a medicine and then never take it, or decide not to later, because they don't really see anything happening. And there are potential side effects or risks with those medicines, so it's worth a discussion. And generally, as physicians, we prefer to hear about that when that decision's made, a week later, 2 weeks later, rather than a year later when we see a patient back and their osteoporosis has advanced. That doesn't mean that you're going to get in a big battle, but if a patient calls me up, I might say, okay, that's fine. Here are some alternatives that we didn't get a chance to let you know, because there are so many options. Sometimes we don't have the chance to tell you what those options are when we believe that you're following down the course that was recommended. Okay, so we encourage communication, a give and take with your physician. It should be a partnership in your care. You need to take an active role in your care, but keeping your physician in the loop will help you get better care for yourself and better outcomes. And if you have a compassionate, caring physician, they always want to take your feelings, your concerns into consideration. Perhaps they'll be able to address them and allay your fears, or perhaps they'll come up with an alternative treatment that fits with your comfort level. So I hope you found this useful, and please leave your comments. Thank you.